The following is a paid commercial program paid for by Currie Health and Wellness Diagnostic Center. The opinions and views expressed in this program belong to its sponsors and are not those of this station or their affiliates or employees.
Hello again, friends. I'm Dave Woodman, and I'm here with Dr. Keith Currie and our special guest, Dave, who is a retired police officer with the North Little Rock Police Department. I'm going to get to Dave in just a minute, but Dr. Currie, most of our viewers know Keith Currie, the doctor, because they've seen you on television for all of these years, but they don't know much about Keith Currie, the man. This guy's an Air Force veteran. He's a true blue Arkansan, raising his 4 children with his wife, Natalie. He's been in private practice for 18 years. Most of those 18 years, you've been right here on television, and we've seen dozens and dozens of his patients sharing how he changed their lives. Dr. Currie, some of these folks have even said you saved their lives.
Yes, sir. It's just been remarkable. I mean, I don't see myself ever stopping doing what we're doing because people need what we have to offer.
Well, I hope you don't, because I enjoy working with you.
Yeah, right. It's just so much fun, Dave.
Dave, as I said, is a retired police officer. Still stays in shape. I bet you work out every day.
No.
Tell us how you got involved with Dr. Keith Currie. It's always a matter of pain, so let's start with you.
Well, I've had chronic pain now for 26 years. When I hurt my neck the first time was 26 years ago. I was 35 years old. And funny thing was, probably the last 15 years, my late mother-in-law had just kept telling me, you need to go see Dr. Currie. And this being that, different things went on, and this year, just this January, I started. And my meds work now. And for years, my meds didn't work, the shots don't work. I even flunked out of pool therapy.
Oh, no.
And
No.
This year, in January, my wife and I had a long conversation, and I ended up going to Dr. Currie, and after 2 treatments, it was really funny because one of the other ladies had mentioned how he sings and plays guitar in the treatment room, and we lost my mother-in-law just over a year ago. Well, Dr. Currie had asked for any requests, and Mama always loved the old rugged cross.
Oh, yeah.
And he did it for me, and I laid there and cried, and on my way home, it was different. And since then, I've come out of the deepest, darkest black hole of chronic pain.
He starts with the physical, but then we have a spiritual aspect of our lives
absolutely.
as well. And when you don't feel good, you don't feel real spiritual, right?
No, you don't.
But when you feel good, when the pain is gone, life changes.
It does. It completely changes. I have my joy back. I smile again.
We're in our last minute. We haven't even talked about this. You've had, a couple of spinal fusion surgeries?
3 surgeries. When they did my neck the first time, there were 2 levels that they couldn't even do because it would have weakened the neck too much.
Yeah. So folks, I think what David is saying here is, don't go through all that surgery. Don't go through all those injections.
Absolutely.
Go see Dr. Keith Currie.
Absolutely. And he'll tell you if he thinks he can help you or not. If he can't, he'll tell you that. If he can, he's going to try. And he tries so hard. Every single day that I go in, his staff, they're wonderful. They listen. They're so proactive with every single one of us. It's awesome.
If you or a friend or loved one is suffering from scoliosis, sciatica, lower back pain, or neck pain, you should book a consultation with Dr. Currie. To learn more about all these painful chronic conditions, call the number on your screen right now to get your free copy of his report explaining how you may be able to get relief. Call Dr. Currie right now to get your copy of his free report. Until next time, for Dr. Keith Currie and Currie Health and Wellness Diagnostic Center, I'm Dave Woodman.
The proof is in the patient. Me.
The proof is in the patient.
The proof is in the patient. And I'm looking at her.